Welcome back to our economic evaluation session. This is the session 3. And the name of the session may be a little different than what you have seen and what I am saying here, but it's the same. Like it's the concept of cost in overall economic evaluation. The purpose of this session is to understand where the cost lies. The concept of cost lies in the overall economic evaluation thing. If you remember, I told you earlier that there are several types of economic evaluation. We spoke about cost minimization. We talked about cost of illness studies. We talked about cost effectiveness. We talked about cost benefit. I hope you still remember what I said. Just for a recap, can you very quickly write in the chat what is the difference between cost effectiveness and cost benefit? Very quickly, the main difference in the chat, please. What is the difference between cost effectiveness and cost benefit analysis? Anyone? Can anyone remember? Please write in the chat. Great. Great. Okay, so at least I can see that 2 persons remember this. Okay. Okay, there are a lot more coming. Okay. Okay, so I'm glad that some of you still remember what is it, what was it, what did I say? So, okay, basically cost effectiveness, I am telling it again, because as I said earlier also, there is a whole lot of confusion and interchangeably these two terms are used. So I again want to make sure that cost effectiveness and cost benefit analysis are two different things. Cost effectiveness basically shows the outcomes in terms of natural units, which is maybe cost per death averted, cost per reduced hospitalization, cost per finally DALYs averted, cost per quality adjusted life year gain, something like that, which are natural units. But when we do cost benefit analysis, we have to ensure that whatever my outcome is, if it is deaths averted, I have to make sure those deaths averted are converted into monetary units. So basically in cost benefit analysis, my cost is in monetary term. Cost is always in monetary term. Benefit is also in monetary term. So that's the basic difference between cost effectiveness and cost benefit analysis. Okay. So I'm glad to see that some of you remembered this difference. And as I mentioned that cost effectiveness, cost benefit, these are full economic evaluation because this takes into account both cost part and then benefit part, outcome part. But cost minimization and burden of illness or cost of illness studies, basically these are partial economic evaluation because we do not consider the outcome part here. Now, today's topic is cost in economic evaluation or economic analysis. As you can see, in all these cost minimization and in all four, you see the cost is the central part of it. So unless and until you do a cost estimation of it, you cannot do any of this work. So cost lies the central of your analysis, any economic analysis, be it a partial, be it a full economic analysis, you have to have the cost component in it. So it is very important now. In next today and next another day, I will be talking about the cost. That's because, as you see, that whatever you want to do, you need to do the costing. Let's move to the concept of cost. So basically, when we talk about cost, what does it mean? Here also, I have seen a lot of confusion while people talk about cost. So let me start with the basic definition, and then I will tell you what is the confusion among researchers, those who do not know the terminology properly. So cost is actually the valuation of resources, okay? It's a valuation of resources. Now, what are those resources? In economics, there are four main resources without which we cannot do anything. I mean, that's the basic concept of economics, that we have four resources. If you think of any intervention, any program, anything, think of anything, whatever you work on, see that you need those four resources: land, labor, capital, and organization. Land, you can imagine, it's the land or the building or anything, you need that. Labor, you need. Capital is the money, or the asset. I would not always say the money, it can be asset also. So capital you need. And organization, meaning infrastructure, like it could be a structure like a management or something like this, you need that. So when I say organization in health sector, it's basically the hospital setup. I'm not talking about the infrastructure that comes in capital, but the other management, etc., that is required to run the system. So all these resources, if you try to value those, when you are trying to value those resources, that is the cost. So now the confusion starts when you think of whether this value is just the money. Suppose labor. Think about the simplest thing is the labor. Now let's give my example. I am a labor. Labor does not mean that those who are doing just laborious. I mean, what should I say? Like when we say labor, often it means that those who are daily wage earners or something like that. No, it's not. People, actually, we can call it human resources, okay? Let's put it broader. Labor is also broad, but it may create confusion. Let's think about the human resource. And let's think about myself, okay? So I have some specific work at my organization, okay? And among all those work, one of the work is today's teaching. Do you think that if I want to value my time for the teaching, for today's teaching, and if I put my whole salary as the value, is this a correct thing? No, because I'm not giving 100% of my time for this teaching. I'm giving only a proportion of my time for this teaching, along with several other work, right? So if you want to value my time, that is value the time of the labor, it's the cost. Okay, so if you think of price is exactly equal to cost, no, that's not right. If price would have been equal to cost, then my time today will be exactly my salary, which is absolutely wrong. That cannot be the right thing to do, right? So when you are valuing the resources to find out what is the value of my time for today's teaching, That's the cost of my time. I hope it is clear. So similarly, so that's what I am trying to say, that every time price is not equal to cost. We have two types of analysis. When we do a cost analysis, we can do it either from an economic perspective, or like we call it a financial analysis, or we may call it an economic analysis. Okay, that is a cost analysis from a financial analysis point of view, like financial cost or the economic cost. Now, what is the difference between these two? Financial cost is basically what I said. Like if you think of financial cost, you will think of like the total price for the cost for the activity. You can put it. I am giving you more examples so that it is clear to you. But economic cost is no. So what the example I gave you right now is an example of economic cost, because as I said, if you are interested to know what we call, say, CTC of the company for having Susmita in the company, that's the financial analysis. Because then my whole salary will be put in, and then it says that, oh, this is the financial cost of having Susmita at TGI. But if the question is, what is the value of Susmita's time for doing this teaching, then it comes to economic cost, because we are valuing the time for a particular activity. It's not only directly the price. Okay, so that's the difference. Let's get into easy examples, easier if you think so. So basically, when we think about economic cost, it is basically the opportunity cost. Why? Those who are not familiar with the economic terms, opportunity cost is the cost of next best alternative. Because suppose all of us have a lot of activities to do, right? And activities does not always mean that it has to be for money purpose. Okay, activities could be, and that's where a lot of confusion comes in when we do the costing. So when, suppose if I was not teaching now, what I was supposed to do? Maybe I was supposed to do some other work at the for my projects. So when I'm doing this teaching, I'm unable to do the other thing. So I'm missing something. That's my next best alternative, because I'm unable to do this, because you cannot do two things simultaneously. When I'm doing the teaching, I cannot do that. All of you, those 30 participants who were attending today's class, all of you had some other things to do during these 1 hour, 15 minutes or something time. But you are here, so you missed something. And that missing something, if you want to cost that, so we have always to cost this. Now, why? Because think of any program now. Come to our any program, government program, okay? We always say that say, for example, we always say we do not have enough nurses. We do not have enough ANMs to do the services in the primary health center or whatever. Now, if we keep giving ANMs or ASHAs a lot of work, what will happen? This economic cost, that is the next best opportunity cost, will sum up, right? So she is doing this and she is not doing the other thing. She is doing this, not doing the other thing. If you sum this up, at some point, you will see that she is doing more than 100%. What does this mean then? This means that we need new resources. And when you do economic cost or trying to understand the opportunity cost, it gives you that wide range of things, which says that it's the sustainability issue. That's why the problem arises when you keep giving ASHAs and ANMs whole lot of work. you will see that they are doing particularly few of their work and not doing the others. Why? Because they can't do. Because you are keep giving them a lot of work. So there, obviously, for one person, it is not possible to do everything. And that's the opportunity cost. And so the reason of doing the opportunity cost is to see whether this program can be sustainable. If my health system is already constrained with less number of resources, human resources, and if you keep giving them a lot of work, you will see it will not survive after some time. It will not work properly after some time. And that's the reason why you should do an economic cost, which will give you that broader perspective, how much extra time persons need to give for these activities, because these are really extra. But the thing is that government often is not interested in this economic cost, because they think that, oh, I have my ashas and ANM, and whatever I tell them, they are supposed to do that. Yes, they are supposed to do that. But as an economist, our argument is that you cannot give them everything because of that. Anyway, so the idea is that it depends on whether you are doing a financial cost or economic cost. It is your decision. Why I'm saying your decision? Because who is your stakeholder? To whom are you going to disseminate your work? If you think that the government, you want to tell the government something, ideally you should do financial cost, because government is always interested to know what is the extra amount of money I need to spend to do anything, or what is the cost of running this program or something. They are always interested in money, because they have to prepare the budget. They have to think about how can I get the money for this activity instead of the other activity. Because again, I started our discussion saying that we have whole lot of choices, but our resources are constrained. Here, our resources, meaning the budget, is constrained, and so the government have to think. So you can just think of financial cost, but our suggestion is that you do economic cost, which is actually the sum of financial cost plus opportunity cost. So economic cost is much broader. When I say economic cost, it includes the opportunity cost plus the financial cost. It's not only the opportunity cost, it's the opportunity cost and financial. So you have everything and you can disaggregate. So that's the beauty of doing economic cost, so that you present everything and let the stakeholder decide what to take, what not to take, okay? So basically financial cost is the cash outlays, basically what the money was spent for delivering the program or buying something or whatever. There is another concept which is fiscal cost. Now, what is the difference between this? So I have given an example. Suppose a refrigerator was purchased in September 2023, okay? If you are doing a fiscal analysis, the whole $1,000 for the refrigerator will go for 2023 expenditure part, okay? Because in 2023, you spent $1,000 to buy this refrigerator. So your fiscal cost is $1,000 for that year. Now, when we do financial cost, the only difference is that this refrigerator will run for at least 10 years, right? So you cannot really put $1,000 in 1 year. That's the expenditure. That's true. If the government is interested only on the expenditure, that is a fiscal analysis, you put everything. But if you want to give the correct picture, that is, what is the cost of that refrigerator only for 2023, because 2020, it will run from 2023 to 2032, 10 years. So you have to annualize. You have to come up with the annual equivalent cost. I will tell you all this later, how to do this. That is your financial cost, because that's a portion of cost which is allotted for this year for using the equipment. Okay. So what I'm again trying to tell you is that cost is not the price, not always the price. Okay. There are a lot of things which you need to do to come up with the cost. Cost is the valuation of resources. Like the refrigerator, its price is $1,000, but financial cost will be much less than $1,000 because it has a lifetime. It will not be utilized just in 1 year. It will have a lifespan of work, and you have to come up with a particular year's cost, the year you are interested in to do the analysis, that year cost, by doing some exercise like calculation, and that's the cost. I hope you are getting it. Like, if you have any questions, please feel free to put it in the chat. If there is anything, I will try to explain it again. So in the financial cost analysis, generally, time spent of the volunteers, etc., are omitted because there is no money involved in it, right? Financial cost is interested, as I said, is only the money spent for a particular activity. Suppose a volunteer is working for any purpose. If we are doing financial cost, will not cost the time of the volunteer. But if we do an economic cost, that will come in. Donated items, suppose the hospitals or the or like, say for example, during COVID-19 vaccination, with the examples I'm giving several times, there are a lot of vaccines came from Gavi, and those were donated. We did not have to, we did not pay anything for those initial doses. And there are many vaccines come like this, which are donated vaccines. So when you do financial, we can omit those because people are like, the government is not paying for this. But if you do economic, because why? See, today you got those donations, but if you are looking for the true cost, then maybe at one point you have to pay for this, right? So if you don't cost the donated items, like in your costing, if you don't take into account the donated items, the problem will be you are underestimating your cost and you are not giving the full picture. It may happen that you will not get the donations all the time. So you have to find out how much the money will be required if I consider these donated items. And that's why you have to do the costing if you go to economic cost. So economic cost, basically, as I said earlier, it addresses the sustainability. It takes into account the much broader perspective, and financial cost takes into account the affordability, how much the government can afford. That's the money. So basically, if you are interested in money, go for financial. If you are interested in much broader perspective, go for economic. Basically, you have to do all financial, plus you have to take into account that opportunity cost, basically. That's the difference. Here, I want all of you to be very careful when you use the terminologies. I put it in a single slide only because I regularly hear this. When I say that how much I need to know, suppose for any of my work, I tell people that this is the data I need. I need to know what was the actual expenditure for this year for the program. They say, yes, we have the budget. No, budget is not the expenditure. So this is, those of you who are attending today's session, please be careful while using these terminologies. As I spoke earlier, cost and price are not the same. I hope you understand that price is something which is the market value of it. The example I gave for refrigerator, $1,000 is the price of the equipment. but the financial cost of the refrigerator will be something else. We have to calculate that. We have to value that. And that is the cost of the refrigerator, not the price. Price is $1,000. That's very clear. But cost is not $1,000. If we think of fiscal cost, different, but financial cost, economic cost, no. $1,000 is not the cost. Cost, we have to find out what is the cost for that particular year when we are doing the analysis. So cost and price are different. I gave another example of myself. My salary is the fiscal cost, is the price for the company, what we call CTC, right? But cost of my time for today's session is totally different. And that we have to calculate, we have to value, and that's the cost, that's not the price. So I hope you are clear that cost and price are not the same. Let me quickly check, there is a message. What is the difference fiscal cost and price? Fiscal cost, generally fiscal cost will be, okay, so let's think about it. $1,000 is the price of one refrigerator. You have bought 10 refrigerators. Cost is 1,000 into 10. That's the cost. If it is one, then it's fiscal exactly equal to the price. But if you have you have multiple things or something, then it becomes cost. But generally, fiscal is approximately equal to price. Okay, but remember, always you have to quantify. If you have more numbers, then price is not exactly equal to cost, right? Because cost is, again, then you are multiplying by the numbers. Okay, I hope, Usha, it answers your question. If not, please put into the chat again. Coming to the budget and expenditure. Budget, as I started, when I say I need to know think about any of your program, where you work, like if you work in smart mental health, or if you work in any NIHR project, or anywhere, think of anywhere, any project, you are epilepsy, whatever you are working on currently. If I want to know what is the actual expenditure for 2023, the immediate response I get from the researchers is that, yes, we have our budget and we can give it to you. No, budget is something which we planned for. Budget is something which we thought that we will spend this way. But expenditure is which we already incurred. And budget and expenditure may not be the same always. As you all know, I'm sure that all of you have some experience of doing a budget. So when we do a budget, for different heads, we try to think what is it and how much will we spend, etc., etc. So that's the plan, how we are going to spend the money. But after 1 year, you may see that in one head, you spend more. In one head, you have a lot of money unspent. That's the expenditure. And in financial costing studies, we need the expenditure, not the budget. And every time when we go and speak with the government for any of my work, I always get this response that, oh, we have the budget. But that's not correct. And we have seen this, we have seen this in many a times, that the budget head and the expenditure head are not at all matching. Now, so why we need the expenditure? I'm giving you an example, okay? If you know about the routine immunization program of our country, you may know that the vaccines generally go to the state depot, And then it goes to the district depot, then to the CHC, then to the PHC, finally to the sub-center or to the outreach session where the vaccinations happen, right? This is how the chain is. It's not vaccine. It could be any supplies. I believe they also go in this same chain. Now, I'm telling you what happened for vaccines. Suppose there are 6, 7 vaccines which are supposed to come to the state, and the district is supposed to collect this from the state. So based on this, the budget was every month the district will go and collect from the state, because when the district goes to the state, there is a money spent, right? Because there will be a vaccine van, there will be a driver, there will be a person, so there will be fuel, there will be usage of the vehicle, etc., etc. So the budget was every month there will be this one trip for getting the vaccine from state to district. Okay. What we found that instead of 12 trips in a year, they made, say, 26 trips. Why? Because they were supposed to get 7 vaccines at one go, but when they went, they found that one of the vaccines is not available. So they had to go again. That was not budgeted. So instead of 12, when you look at the expenditure, budget was for 12 visits, expenditure was for 26 visits. How did the district manage to get these extra visits? That means that they had to get the money from other sources, right? From RKS fund or any other fund. The district have several other funds. So instead of immunization fund, they have to take the money from MCH fund or RKS fund or any other source. So that this is what I'm trying to say. Budget is not equal to expenditure. And in costing studies, we always look for expenditure, not for budget. Budget will not give you anything. But budget will give you some idea about how we wanted to do, but it may be totally like, say, for example, during the COVID thing. Do you think that any of the budget for any of the program in our country did really work during COVID time? No. If you look the expenditure, it will be totally different from budget. So a costing study really requires the expenditure, not the budget. And I hope you understood the difference between budget and expenditure. So please use the terminologies correctly. Coming to charge, this is also I have heard several times. When we talk about cost, people say, we have the bills. Suppose I'm thinking about the cost of doing an X-ray in a government hospital, or think about a private hospital. Government hospital is even complicated because X-ray will be free, or maybe 50 rupees or something. Or think about a private hospital, okay? Private hospital, if I say that I need the cost of X-ray, we have to find out the cost of X-ray, doing X-ray in a private hospital. The immediate response you will get from the private hospital is that, yes, this is 150 rupees. What is this 150 rupees? That is the charge. That is the charge the private hospital charges from the patient. Okay? That's not the cost. Why? Because in a private hospital, this charge includes, this is cost plus profit margin. First of all, they do a very rough estimation of the cost, like not the way, of course, not the way the economists do. They do a rough calculation of, I need this plate, I need this, but they generally ignore the time cost because they always say that, oh, I am paying for this money for this. But so they don't consider that, but they somehow come up with an estimate of how much it will be for doing an X-ray. And then they add the profit margin. That becomes a charge. And that charge is what is 150 rupees, which is charged from the patient. That's not the cost. The problem is that you don't know how much is the profit margin. If we knew what is the profit margin, then you could have guess something, but we really don't know what is the profit margin. So charge is not the cost. If you want to do a costing of any services provided by any sector, you have to do the costing, where you have to find out everything. I will talk about those, how to do that. But what I'm trying to say, the difference between cost and charge, I hope it is clear to all of you that all these are different terms, and you have to be very clear when you use the term, and you should know which one to use when. If you don't get any data, if you don't have time to do the costing, and if you are not finding anything from the literature, you may go for the charge, but I would never. Charge is something which actually overestimate. In case of private hospital, you overestimate your things, and in case of government hospital, you will see there is no, actually, if you think of that, government hospital does not charge anything, right? And that is, if you go and do any study in government hospital, the immediate answer you will get that, oh, this is free, we don't charge anything. We know, but providing that service requires a cost. I mean, there is a cost involved to provide each and every service by the government hospital. We have to calculate that. So that's the difference. I hope it is clear. Please feel free to go and ask any question you have. Okay. Now coming to the concept of cost to whom. Again, I hope you remember that I talked about the perspective. I hope you remember. Perspective, I said it could be patient perspective, it could be provider perspective, it could be societal perspective, it could be third-party payer perspective. And perspective determines which costs are to be included in the calculation. There is a question, let me quickly check. Charge and price, how does it differ? Okay, let me give you the example again. Price. Price, okay, think about an X-ray. Price of X-ray does not make any sense, right? Price of it could be the price of the components. It could be the price of the X-ray plate. It could be the price of the chemical used. It could be the price of something, which after summing all those by multiplying the quantity by the price, you come up with the cost. Not exactly like that way, but there will be some calculation to come up with the cost. So price is basically the components, different components, which you bought from the market. That's the price. Then you multiply by the quantity of each of the components. You get the cost, not always exactly equal to only multiplying. There could be apportionment also, which I talked about. Let's think simply. You have 10 X-ray plates whose price are 100 rupees per plate. So 10 plate multiplied by 100 becomes your cost. 1,000 is the cost plus 10% profit margin. 1,100 is the charge. Is this clear? So basically, price is the price of the components. When you multiply this with if that is a single component, then price and cost becomes the same. But if there are multiple quantity, you quantify and get the cost plus something, that's the profit margin. Cost plus something, that's the charge, which is charged from the patient. So that's the difference between cost, price, and charge. Does charge also include service charges, taxes, others levies? Yes, it could be. I mean, honestly, Srishti, we don't know what is included in the charges. We never get any sense of. I believe taxes are already. See, when I buy something, the components, say in my example, x-ray, whatever components I need, right? The materials, consumables, whatever I need. So x-ray plate, when I'm buying the x-ray plate, it already includes the GST or whatever is included, like the taxes, right? What you were saying. So price already includes whole lot of things. Then those taxes are already included. Then when it is coming to cost, we are calculating. Now charge, what else is added in the charge, like whether it is only profit margin, if it is profit margin, how much it is, or it is included some overhead, or it included, actually ideally in the cost there should be overhead included, but again if there is any overhead included in it, overhead meaning the services of the other people who are involved in it, or electricity or other things, whether that is also included, we have no clue. We don't know. So that's why I'm saying, if you start taking the charge in your cost estimation, it will surely be overestimation for the private hospitals. Example for price and cost. Okay, price and cost, as I said, cost is the valuation. As I told you, let me give again my example. The cost for myself, the price of myself being at TGI is my salary. That's the price to the company. But if I think of though it's caused the cost to the company, but in costing situation, if I want to cost my time for today's session, if I put my whole salary, which is the price, if I put whole of like my human resources price is the salary. If I put my whole salary for today's session, it's wrong, because I'm spending only a fraction of my time for today's session. When we try to calculate that, what is the cost of my time for today's session? That's the cost. That's not the price. That's not my whole salary. That's the difference. Like, it's the difference between the whole thing and the valuation. It's not always equal. As I also said, the refrigerator, when the price is $1,000 is the price. Financial cost, fiscal cost is $1,000. But when you are costing it, it is for 1 year service. And that's become the cost, because that's the valuation for 1 year for the refrigerator. I hope it is clear now. Keep asking if it is not. I'll try to explain again. Now, cost to whom? So I talked about the perspective. Can anyone remember which one was the broadest perspective? Can anyone remember this? Which? Oh, there are a lot of question answers. Okay, great. So societal perspective, why? Because societal perspective takes into account patient, provider, societal, of course, third party payer, whatever, whoever pays, that should come into a societal perspective. That's why it is the broadest perspective. Now, today I'm mostly talking about the patient perspective. Now, think about patient perspective, meaning suppose a person is suffering from a disease, from any disease, okay? This is what is called cost of illness study. Suppose the patient has a mental disorder, or the patient has TB, tuberculosis, the person has diabetes, person has any problem, hypertension. There is a cost associated with the treatment, right, for that illness. So that's why it is called the cost of illness study. And those cost of illness studies are actually from a patient perspective. It is a patient cost, it's a household cost that is not related to the government. It's, suppose I am a person who is suffering from any disease, say for example diabetes. So for diabetes, think about it. All of you have experienced any diseases in your life, right? I hope. Or your family members. Think about any disease and think about where did you actually pay. Because cost of illness studies, generally, one component of it is the out-of-pocket payment. So where do we generally pay? The out-of-pocket payment can be for direct medical purpose or direct non-medical purpose. These are the terms we used. Now, direct medical purpose, it could be for consultation, it could be for drug, laboratory test, bed charges, anything, which is directly related to the medical, like it is medical thing. But non-medical is, it is direct, that is you need to pay the money, but it is not for that, for medical purpose. I mean, when I say medical purpose, because that is for the illness, but what I'm trying to say is not, it is related to the disease, but it is something else. Say, for example, travel expenses. Say, for example, it is the accommodation, because suppose for a disease, I have to travel to another state to seek care. So I have to take a hotel or guest house or something to stay, right? But that is for my illness. So that accommodation. Payment for special requirements. Say, for example, someone had stroke and had to buy a wheelchair for that. So those are actually payment, because those are paid, those are bought through money. So those are payment for the patient or the household member, but not really for directly medical related thing. It's something related to the illness, but it's not really directly medical, which is consultation, drugs. This is direct medical, right? So patient cost will have three different components. One is direct medical cost, which will include all this consultation, drug, as I said. Direct non-medical, which will include travel expenses, waiting time, travel expenses, accommodation, special requirements. Suppose one needs to pay to the helper while hospitalization because the person is bedridden. So you are paying for the helping staff for that person. So that is that payment, those payments. Or suppose diapers are required for any illness, you are paying for that. Those are all non-medical, but related to the disease. And another thing you should remember, that for that disease, you should always consider the disease for which you are doing the costing analysis. It should not be something else which is happening. Suppose a patient with diabetes is having some condition, you should not cost that. You will concentrate only cost of the disease, because cost of illness study generally focuses only on cost. Like when we did this huge, I'm sure those who you are at George, you have listened to me during our R&D sessions, the cost of illness of what we did is economic burden of TB. I was asked whether I did TB and comorbidity, like the cost of comorbidities. No, it's not. When we think of a cost of illness studies, we don't think of the comorbidities. We think only, because comorbidity will have other costs. So don't think about this. It's the only cost of the disease you are interested in, okay? So these are the direct cost. And then you will have to have the indirect cost. These costs are the time loss of the patient, the time loss of the guardians. Guardian means anyone who is helping the person during the illness. Okay, it could be friends, it could be neighbors, it could be that person could be can be anyone. Okay, but that percent, if the person is losing the time and or wage loss is there, you need to consider those in the indirect cost. So indirect cost is something which is basically the time loss or reduced productivity. What does it mean? Suppose someone used to work for 8 hours before the disease and now working for 4 hours. That's the reduced productivity. 4 hours is reduced. So if you want to cost that, it is up to the researcher of whether how you want to calculate the indirect cost. But indirect cost generally takes into account the wage loss of the patient or the guardian. It's up to you, okay? Indirect cost can also be like the informal caregiver. Suppose a person is so sick that someone in the family is taking care of the person. That's the informal caregiving. So that can also be costed in indirect cost. I did not put it here, but you can go to those portions also. It's up to you how you want to calculate, but these are the components of indirect cost. There are different estimation methods. One method is the human capital approach. That is the time loss, okay? Time loss is generally calculated using the human capital approach. This approach, suppose if someone is sick and went to a PHC for seeing the doctor, okay? Now, there will be a travel time for the person. There will be a travel time for an accompanied person, if there is any. There will be a waiting time in the PHC. There will be a doctor's consultation time. And then there will be a travel time back home, right? This is the whole circle. Now, you are calculating that time cost of the person who is sick and the accompanied person. How are you going to do that? So you know the hours spent for travel. You know that it could be half an hour for travel. It could be 15 minutes for waiting. It could be 15 minutes for doctor consultation. So 1 hour is spent. Now, how to value that 1 hour for that person? One way to value this is if the person is working and the accompanied person is also working, this makes things complicated, because then one way of doing it is that you ask them what is their wage. And that's the most difficult question when you do the costing study. Income is the most difficult component to gather information during interviews, because people generally do not want to disclose their correct income. So the alternative is that we can use the minimum wage rate of the state where you are working. Every state has a minimum wage rate for different categories of labor. So you can identify your participants where they particularly fit in, and you can use that. So multiply that minimum wage rate with the time loss, and you get the time cost of time loss for that person or accompanied person. So there are two ways. One is you can use the reported income, or you can use the minimum wage rate. Anyway, another approach is friction cost, which is not generally used, but there is a definite that is there in the theory. So I'm just discussing. Friction cost is actually, it said that suppose someone is unemployed because of the disease, the society will friction cost approach thinks that if someone is not working, another person will replace that person, right? It will not be vacant forever, right? That position that will be filled out. Now, as soon as that position is filled, there is a gap between the vacancy and the filling out, right? This gap time is costed in friction cost, which is extremely difficult, because we really don't know when we may know that when the person stopped working, but how will we know that when the position was how long the position was vacant, when it was fulfilled, it was filled out? We have no idea about that, right? So we never use the friction cost method. We generally used human capital for time loss, and output approach, when we say, it's the income loss. So you can do the income loss calculation by asking one simple question: ki, how many days of income did you lose? So that a simple question from which the number of days, and if you know the per day wage, you just multiply. That's how you can do through the wage loss. But as I say, wage loss is wage is a difficult thing to ask. Now, another problem with the income loss approach is that not everyone works, right? Suppose a housewife has some disease. Don't you think that we need to cost the time spent for the housewife for the disease? We have to, right? And that's the time cost. You cannot do the wage loss, right? Because that the housewife will not lose any wage, but the person will that she will lose the time, and we have to cost that time loss. So from an equity lens, time loss is more valued because it considers everyone. I got this question several times asking that why are you valuing a student's time? Because the student because the student is sick, he or she is not studying or not playing or not watching TV or not whatever he or she was supposed to do, the opportunity cost. The student is now missing something because the person is sick. That's the time loss, right? That which we need to consider from an equity lens. So time loss is always considered. For me, that's the best thing to do because we are putting equal value to everyone. If we take into account like the minimum wage rate, then we are putting similar value to everyone. And that makes sense. But wage loss will be applicable only for those who are earning something, right? Now, the point is how this cost of illness will fit in the economic evaluation, because we are ultimately interested, though we can do a cost of illness study definitely, but if we want to put this cost of illness information from a patient perspective, how does it fit into the broader economic evaluation? Think of it. Suppose someone has this disease and you are giving an intervention which will reduce all this cost, right? You are giving an intervention which is supposed to reduce the time cost or supposed to reduce the disease itself. Less number of persons will now suffer from the disease. So then there will be cost saving, right? So in your calculation, this cost, the patient cost, generally comes in as cost savings because your intervention may reduce the number of cases, which means that there will be a whole lot of cost which can be saved if you do this intervention. So that's where it can come. But as I said, it can be a standalone cost of illness study. Okay, so there is a question. Let me quickly check the question. When we plan for a CY study, we must include all the... Yes, of course. When we plan for a COI study, if we plan for a cost of illness study only, if it is your purpose is a cost of illness study, then you have to consider direct medical. You have to consider a proper cost of illness study should have all of this. I may after this session, I may share my recent work, which I'm talking about is a very comprehensive cost of illness study for tuberculosis. And you can see what are the components we took into account and the indirect cost. And in indirect cost, we took into account both time loss and wage loss, and we use human capital and output approach. Maybe I'll share that for you so that you can just have a look and you can understand that how it should come in, okay? So that's the cost to the client. So that's the patient perspective. because everything, as you have seen from here to what I have spoke, is the patient. That is, I, as a patient, is spending or my household is spending, right? There is nothing to do with the government. So here you are, the final cost to the client is, the client meaning the patient here, huh? Direct medical, direct non-medical, indirect. That's your total cost. I hope it is clear. Please keep asking if you have any other question. Now coming to the program. Here I will talk about, today I am going to give you very brief introduction of how it looks like, but we will talk in very detail because I am expecting that many of you will do a program costing. I'm not sure how many you will do that, but you can always do a patient costing. But I think because you are involved in different types of interventions, you will probably do a program costing. Now, program costing, your costing can be classified by different activities. Let's go directly to that. When we talk about inputs, there are two types of inputs in any costing, okay? So think of any of your program where you are working. Mental health program, I see that you are from mental health program, you are from nutrition also, you are from epilepsy, from other, okay, so wherever you are from, nutrition, yes. So think of any program. When you do the costing of any program, you have to identify your inputs in two different ways. One is you have to identify your capital items, and another is recurrent item. Capital items are generally those which last longer than 1 year. Anything which lasts longer than 1 year is capital item. You give me few examples now in the chat, please. Give me few examples of capital items. Any item used for any program which lasts more than 1 year. That is whose life expectancy, if I say, is more than 1 year. Useful year is more than 1 year. Give any example. Correct. Laptops, tablets for data collection, any machine for investigation. Any machine for investigation if it lasts longer than 1 year, huh? If something, if it does not, table chair, yes, table chair. Anything else, anything you can think of, these are all capital items. Patient bed, correct. EEG machine, X-ray machine, right. EEG machine, X-ray machine, of course it lasts more than 1 year, but remember that capital item should last longer than 1 year, okay? There could be some machine, say for example, I'm thinking of like the hub cutter. If you have seen the hub cutters, it lasts for 3 months, so it cannot be. Okay, so good, you understood what are the capital items. And the recurrent items are those which are regularly required. Anything, any expenses which you made for the operation of the running of the program is the recurrent cost, okay? So there is a difference between capital item, and I'm glad that one of you told that human resources is a capital item. Of course, yes. So now here are the examples of capital item: building, vehicle, equipment, training. Why training is a capital item? Because generally, suppose the training of trainer or curriculum development workshop that happens once, and it may, like even the refresher training for medical officer or refresher training for NMs, ASHAs, that happen after 3 years. So life is longer than 1 year. Social mobilization, for example, you were doing IC material, you develop some IC material, like Srishti, I remember that you developed something that will last longer than 1 year. And those are social mobilization activities, and those are the capital items. Okay. Recurrent item, salaries, supplies, which will be a recurrent expenses for the activity, whatever activity you were thinking. Building operation like electricity, water, telephone, fuel, spare parts, equipment. Recurrent. Training, recurrent. Say, for example, you are doing a training and you are providing refreshments, you are providing travel expenses, you travel reimbursement for the participants. Those are recurrent. But the training itself, the learning, the training itself is a capital cost. But other activities are recurrent, okay? So these are some examples of recurrent cost items. Service delivery. Any program will have some delivery, will have some activities. You think of your program again. Your program must have some functions, some activities. Say, for example, there could be transport, there could be training, there could be monitoring and supervision, there could be program management, anything you can think of. So your classification, your cost can be based on this. Like you can cost the service delivery, you can try to figure out what is the cost of transport, you can try to figure out what is the cost of training. So your cost, first thing we said, can be by inputs. What is the capital cost? What is the recurrent cost? Now, your cost can be, what is the cost for doing this activity? What is the cost for doing that activity? So that way also you cost, what we call it, activity-based costing. This is what we call is activity-based costing, okay? Then your cost can be at different levels. Suppose you are doing a program costing, cost for running the epilepsy program in the country, okay? That's a national program. So you have national level cost, you have state level cost, you have district level cost, you have below district level cost, health center cost. It's up to you how, like which level you are doing the costing. You may ignore this also. If you are doing a particular intervention costing, then this is not applicable. I'm giving you all these examples so that you know you have all these options. In a national program, like when we did the program for immunization, we have costing at the national level, we have costing at the state level, district level, CSC level, PHC level, sub-center level. We had costing for top to bottom. So it's up to you how you want to do it. You can cost by donors, because by the sources, like you can see your program, how much is the government contribution, how much is the state government contribution, how much is the donor contribution, if there is any NGO contribution. So you can always see cost by different sources. After doing the costing, you find that out. Okay, so that's all for today. Very briefly about the program costing, because I will go in detail about the program costing the next day. If there is any question, feel free to write in the chat, get back to me later if you find anything to understand. What is it? There is a question. If a person requires hour or two for the consultation, but my I'm losing entire day wage. So, okay, so the question is, Srishti is asking, if a person requires hour or two for the consultation, but might end up losing entire day wage, what do we factor in such a case? You are talking about two different things, Srishti, but you can consider both. So come back to this. Time loss is 2 hours multiplied by the wage is through the human capital approach. That's the time loss. That's a different indirect cost. That's a time loss. But if the person loses the whole wage, so here the whole wage and 2 hours of time loss is not the same, right? So you decide whether you want to report the time loss, which is 2 hours, that is wage for 2 hours, you have to multiply. You have to calculate what is the time loss. If you want to represent the time loss, then calculate the 2 hours thing. If you want to present the wage loss of the person using the output approach, you present the wage loss of the person. So it's up to you how you want to, and you can do both. you can say time loss, cost of time loss is this, cost of wage loss is this. So yeah, you can do both. Hope this answers your question. Okay, great.